Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
Why do we need empathy in healthcare? And you may come up with one statement from your whole group, or you might come up, each one of you have a statement. Write it really large on that 11 by 17 inch paper. Okay, so enjoy and get to work.
It's almost funny that we have to ask the question, why do you need empathy in healthcare? Because it's natural. Like it's, if someone is in pain, I think it's natural to feel empathy for them.
I just don't remember ever having any problem in Holland, France. That's with different languages. You know, I got sick. They said, there's the doctor. You go to the doctor, you get the thing that it's taken care of with your taxes. You shouldn't, as a patient, have to be worried. With the system, it needs to be empathetic, and that'll filter down. If you have a real simple.
They don't seem to have empathy. They're so caught up in the latest technology. Have you noticed that? You go to the doctor's office and they're busy writing everything on their computer, so they're hardly even looking at you.
It's taken us away from empathy. You know, I was reading today about the economy. And in the economy, you know, it's like competition. It's all competition driven. Whereas if you have empathy, then people can work together. And we're at a point where we can begin to see that we can work together on it.
Shifting to a more cooperative language, and then same with healthcare. Have patient and physician not working against each other, but working together towards.
It's good. Same with teaching and any other environment too. It's not that somebody has the wisdom or knowledge, like the lady was talking about the prescription drugs. It's like, I know this and I'm trying to give this to you because I know it to be true. It's like, I don't necessarily know what's true for you, but you know, like, let's have a conversation and let me listen to you.
You want your doctor to be competent above all else, I would think.
But I think because I've been sitting here thinking about the question of time, because I just saw my cancer surgeon yesterday. He left the institution where I went to him for my surgery all those years ago because he was being asked to just shuffle people through. He didn't want to do that.
Right.
So now he's affiliated with another hospital and he does it the way he wants to. But the consequence of that is that he does not take insurance. You have to pay cash when you go to his office at the time of the visit.
The loss of empathy and the focusing on the value around acquisition, you know, material acquisition, and then in many cases it is about the money, you know. Short, because she wants to be with her family in the place that she's, you know, accustomed to, and you have to let her go. And it was a big fight because the doctors felt, you know, like their allegiance is to do no harm, right, supposedly, which means keep everybody alive. But there's nothing in the teachings of letting people die a dignified death.
I had one doctor that had scheduled me for a physical exam. And he was a very human type person. You know, he did a lot of sports, he was engaged in a lot of things. And I was really starting to grow in confidence with him. And yet, the one time I was in his waiting room, waiting for that physical, without consulting me ahead of time, he walked into the room with two medical students and started to talk about me as if I was part of the furniture, and they were learning about, you know, what he does in an examination.
Right.
And he
nobody
never
asked your
had
permission.
the courtesy or the sensitivity to tell me ahead of time I'm going to be coming, and I'm sitting there with my shirt off, you know, a young girl and a young guy comes in, and to me, you know, it was kind of, I had mixed feelings about him. I didn't feel that he wasn't empathetic, but I didn't feel that he was totally empathetic either.
Yeah.
And he was kind of more, you know, somewhere in the middle of that.
Yeah.
Talking about doctors.
We've got to come to some sort of conclusion, I guess, about empathy and healthcare.
So, are we saying like it's needed in healthcare, or it should be there, or it should be other things, it should be part of other factors?
It should be built into the system.
I think that's the point.
Yeah.
Is that at least the structures should not make it impossible, but should allow for, somebody to.
Before the insurance companies were there as middlemen to get in between the patients and the doctors,
Yeah.
there was a lot more empathy. There was flexibility.
I think
if one patient maybe couldn't afford.
It's funny because I was talking about this with some, because this area is a lot of Obama supporters, like everybody, but there's 50% of the country that's like upset about it, or feels like not really optimistic about the direction of the company, the choices he's making, and yet how do we have empathy for that situation, for these people that don't feel totally enfranchised with the system that he's created, or the
What the Organizing for America is doing is in groups like this all around the country, getting these stories.
And they do.
Well, and that's where the lack of empathy comes from. Like you said, it's like, bureaucrats are ruling on whether or not people can get treatment.
Right.
Yeah.
Right.
Yeah. Like I have this friend, she injured herself on the job, and she's been fighting for over a year to get this special surgery she needs for her hip. And the insurance company is fighting her. She's been to, she's using her money on lawyers' fees.
Yeah.
And it was like, in February she got approved for the surgery. That the court ruled in her favor. And she was all ready to have it. She lined up, friends like myself to help her in recovery. And then the insurance company appealed. And now it's going to be probably, 6 months or more. Yeah. Meanwhile, she can't work.
Been there.
Yeah. She's in pain. It's ridiculous.
Up front, it's going to require to shift into another mode. Right now, we've gotten ourselves into such a problem. There's so many health issues that people have because the systems are perpetuating it, on and on.
I'm doing a number of different part-time jobs. One of them is